Insulin coma therapy. The coma therapy trend began in 1927. Vietnamese physician Manfred Scowl accidentally gave one of his diabetic patients an insulin overdose and sent her into a coma. But what could have been major medical codes past turned into a triumph. The woman, a drug addict who woke up and declared her morphine craving gone. Before long, Sackel was intentionally testing the therapy with other patients and reporting a 90% recovery rate, particularly among schizophrenics. Strangely, however, Sackel's treatment success remains a mystery. Regardless, the popularity of insulin therapy faded mainly because it was too dangerous. Trepanation. The basic theory behind this therapy holds that insanity is caused by demons lurking inside the skull. Boring a hole in the patient's head creates a door through which the demons can escape, and out goes the crazy. Trepanation was by no means a limited phenomenon. From the Neolithic era to the early 20th century, cultures all over the world used it in a way to cure patients of their ills. Rotational therapy. Darwin's logic was that sleep could cure disease and that spinning around really fast was a great way to induce slumber. Nobody paid much attention to it at first, but later American physician Benjamin Rush adapted to the treatment for psychiatric purposes. He believed that spinning would reduce brain congestion and in turn cure mental illness. He was wrong. Instead, Rush just ended up with dizzy patients who were still crazy. These days, rotating chairs are limited to the study of vertigo and space sickness. Hydrotherapy. Some doctors, however, got a bit too zealous about the idea, prescribing therapies that sounded more like punishment than treatment. One treatment involved mummifying the patients in towels soaked in ice-cold water. Another required the patient to remain constantly submerged in a bathtub for hours, even days, which might not sound so bad, except for they were strapped in and only allowed to use the restroom. Finally, some doctors ordered the use of high-pressure jets. Sources indicated at least one patient was strapped to a wall, the suffocation position, never a good sign, and blasted with water from a fire hose. Like many extreme treatments, hydrotherapy was eventually replaced with psychiatric drugs, which tended to be more efficient and more pleasant. Mesmerism. Much like Yoda, Austrian physician Franz Mesmer believed that an invisible force pervaded everything in existence, and that disturbance of the force caused pain and suffering. His basic theory was that gravity of the moon affected the woman's fluids in much same way it caused ocean tides, and that some diseases accordingly waxed and waned with the moon's phases. The dilemma then was to uncover what could be done about gravity's effects. Mesmer's solution used magnets. Surprisingly, many patients praised the treatment as a miracle cure, but the medical community dismissed it as a submissive hooey and chalked up his treatment success to placebo effect. Malaria therapy. As therapy, specifically as a treatment for syphilis, there was no cure for STDs until the early 1900s. Gehrig got the idea to treat syphilis sufferers from malaria-infected blood. Predictably, these patients would develop the disease, which would cause an extremely high fever that would kill the syphilis bacteria. Once that happened, they were given the malaria drug quinine, cured, and sent home happy and healthy. The treatment did have its share of side effects, the nasty subsiding fever for one, but it worked, and it was a whole lot better than dying. In fact, von Yerger won the Nobel Prize for malaria therapy, and treatment remained in use until the development of penicillin came along and gave doctors a better, safer way to be sure to cure the STD. Chemically induced seizures. Nobody ever said doctors had a flawless logic. A good example, seizure therapy. He reasoned that because schizophrenia was a rare epileptic and epileptics seemed blissfully happy after seizures, then giving schizophrenic seizures would make them calmer. In order to do this, doctors tested numerous seizure-inducing drugs before settling on meterazole, a chemical that stimulates the circulatory and respiratory system, and although he claimed treatment cured the majority of his patients, opponent argues that the methods were more dangerous and poorly understood. To this day, no one is quite clear on why seizures can help ease some schizophrenic symptoms, but many scientists believe that the conclusion released chemicals otherwise lacking in the patient's brain. Hysteria therapy. Women suffering from pretty much any type of mental illness were lumped together as victims of hysteria. It composed conditions ranging from nervouses to fainting fits to spontaneous muteness. The root cause, according to doctors, was a wandering womb. Coincidentally, cures for hysteria involved finding a way to calm down the uterus, and why there was no direct method of doing this, including holding foul-smelling substances under a patient's nose to drive the uterus away from the chest. Plato believed that only surefire way to solve the problem was to get married and have babies. After all, the uterus always ended up in the right place when it came time to bear a child. Although womb calling as a psychiatric treatment died a long time ago, hysteria as a diagnosis hung around until the 20th century, when doctors began identifying conditions such as depression, post-traumatic stress disorder, and phobias. Phrenology. Basically, Gal believed that parts of the brain of a person used more often would get bigger, like muscles. Coincidentally, these bumped up areas would take up more skull space, leaving visible bumps in those places on your head. Gal then tried to determine which parts of the skull corresponded to which traits. For instance, bumps over the ear meant you were destructive, a ridge at the top of the head indicated benevolence, and thick folds on the back and the neck are signs of sexually oriented personalities. Phrenology. Basically, Gal believed that the parts of the brain of a person were used more often would get bigger, like muscles. Coincidentally, these bumped up areas would take up more skull space, leaving visible bumps in those places on your head. Gal then tried to determine which parts of the skull corresponded to which traits. For instance, bumps over the ears meant you were destructive, a ridge at the top of the head indicated benevolence, and thick folds in the back of the neck are signs of sexually oriented personalities. In the end, phrenologists did little to make their mark in the medical field, as they could treat personality issues, only diagnose them, and inaccurately at that. By the early 1900s, the fad had waned, and the modern neuroscience had garnered dominion over the brain. Lobotomy. Monists believed that mental illness were generally caused by problems in the nucleus of the frontal lobe, that part of the brain just behind the forehead. So when he heard about a monkey whose violent fences throwing urges lobotomy, Monists believed that mental illness were generally caused by problems in the nucleus of the frontal lobe, this part of the brain just behind the forehead. So when he heard about a monkey whose violent faces throwing urges had been curbed by acute to the frontal lobe, Moniz was moved to try out the same thing on his patients, the lobe cutting, not the fence throwing. He believed the technique could cure insanity while leaving the rest of his patients' mental functions relatively normal, and his admittedly fuzzy research seemed to support that. The accolades flooded in, and one of the lower points in the Caroline Institute history, Moniz was awarded with the Nobel Prize in 1949.